Welcome technicians, we will continue with our NABH related activity. So today we will look into what is called the needle stick injury or sharp injury, even body fluid exposure directly to the body parts. Okay, all these comes under a similar this thing only, but needle stick injury is one of the most important thing that happens. Now one of the commonest reason why a needle stick injury happens is the recapping of the needle. Okay, recapping is totally not allowed in any of the circumstances. If at all, if you have to do, like for example when you are drawing ABG samples and all, during that time if you have to do recapping, then recapping is done by what is called a single hand technique. Okay, this is this thing which explains about the single hand technique. So what you do with a single hand, you would have kept the needle cover, and then to the needle cover you pass the needle, and then with the same hand you lift it up, and then with the same hand using the index finger and the thumb you lock it, and then you throw it. Okay, this is what is the single hand technique. So obviously needle has to be disposed into white colored bins, and the body of the syringe has to be discarded into red colored bins. But if you are doing it for ABG, then you have to send it to the lab. Okay, so this is, if at all if you have to recap and you have no choice, only then it is used like this. Otherwise the needle will be directly put it into white colored biomedical waste and the syringe into the red colored ones. Okay, so when the needle stick injury happens, so first and the foremost thing, don't panic. It has already happened, so nothing much you can do now immediately. So what you need to do is, don't put your hand into the mouth, or don't try to suck it, which is a very common behavior seen in most of the laymen's and all. So don't do that. Immediately go to the tap and wash it in running water. Okay, running water means you on the tap water continuously let the water keep flowing, and you keep the exposed part on the water and let it drain for next at least 4 to 5 minutes continuously. Don't do anything. Don't try to squeeze, don't try to lick, don't try to see repeatedly what has happened and all. So don't do. Let it properly wash. As much whatever the blood is there or whatever exposure is there, let it go. Don't try to squeeze and try to bring more blood out of it. Never do all those things. Okay, once you are sure that you have done enough tap water washing and all, then you take a soap solution and properly do the cleaning with the soap water. Okay, properly you clean it with the soap water, and then you inform the hospital infection control and nurse as well as the your supervisor that such a thing has happened like that. And if possible, if you can find out exactly which patients that needle or sharp is coming from, if you can get it, so try to get that information. Some of the times it will be from the bin and all, so during that time somebody might have wrongly put the needle and all. During that time you can't make out from which patient the needle is coming and all. If at all if you can do that, then try to get that particular information. Okay, once you get that information, then we have to take consent from that particular patient to do HIV, HPCG, HCV test for him. That will be free of cost to the patient, and at the same time you also will undergo this HIV, HPCG and HCV test to make sure that it is not anything bad has happened or anything like that. Okay, and at the same time we also look into your vaccination status for hepatitis B. If you are recently vaccinated and all, we will have to check the the titers in your body. Okay, so if you have a vaccination history is not good, usually almost all of you should have a proper vaccination history which is available from HR department. So if at all there is a question mark or anything of that sort, then we look for the titers, and as per that we go. So once you have informed the nurse, the HICC nurse, the HICC nurse will draw the blood for HIV HPCG test, and then she refer it to your physician who is in charge, and they will do the needful. Like for example, look it for the titers, giving you HBsAg, hepatitis B, immune serum, or prophylaxis for HIV. All these things will be taken care by the professional as per NACO guidelines, or as per this thing. They will follow this thing. Just make sure that within as much as possible, not more than 2 hours, you present yourself in front of the consultant so that they can take necessary action. Okay, that is one of the most important thing about the needle stick injury. First and the foremost thing, don't panic, don't suck, don't squeeze. Go to the nearby wash station, wash it with plenty of water, allow it to bleed, but don't squeeze, and then once you know that everything is clear enough, so wash the area with soap solution and then inform the supervisor of your department as well as the HICC nurse, and then follow their instruction. There is nothing to panic or anything of that sort. Okay, so don't worry about it. Okay, it will be taken care. Next, one more thing, topic which we will try to cover here only is what is called the incident reporting. Okay, incident reporting, please note that incident reporting is not to find who has done wrong, why they have done wrong, and penalize them, cut their salary or anything of that sort. The idea is to make sure that if a particular process is working fine or not, does it require any fine tuning, or there is a gross mistake in the process itself that needs to be corrected. So these things we look into. So never panic to raise an incident, or when an incident is raised, try to whether you have done correctly or not. Okay, so whenever an incident happens, inform your HOD or that such a thing has happened, so that they can raise it. Okay, the HOD will raise it with the quality department, and if at all if you feel that HOD is not raising for some personal benefits or something like that, you can always approach to the next supervisor, either the CEO or CEO, and inform them that such a thing has happened, so that they can raise an incident report. You can directly go to quality department and raise an incident report also. Similarly, when an incident is raised against you also, you don't have to panic. Explain it to your supervisor exactly what has happened in the steps that is required. It is not for, as I told you, is to not to make you a scapegoat or a victim or anything of that sort, but it is to make sure that the processes inside the hospital is working fine. Okay, so then as per that necessary things are taken so that the process can be corrected. Hope you are able to understand. Thank you.